Cancer patients are at really high risk for getting blood clots. Once they get a blood clot, it's actually very impactful on their clinical course. So they're more likely to have morbidity, swelling, pain, more likely to be admitted to the hospital, more likely to need anticoagulation for almost an indefinite period of time. And it's the second leading cause of death in patients with cancer. So after cancer itself, thrombosis is the second leading cause. So it's certainly something that needs to be prevented. The challenge has been that the risk for getting blood clots is very variable amongst cancer patients. So there's some cancer patients that are at really high risk and some patients that don't have that much risk. So the reason we did the study was to pick just the high-risk patients, and we picked them based on a risk score that we had developed a few years ago. And only the high-risk patients were randomized to receiving deltapirin, which is a low molecular weight heparin, versus observation. The study essentially proved that, first of all, the high-risk patients were at really high risk. So 9% of them had a blood clot even before they started on chemotherapy. And an additional 21% in the observation arm developed a blood clot over the 12-week period, which is not that long to get a blood clot. Yeah, so the risk score is a very simple score. It takes 5 simple clinical and lab variables: the type of cancer, the components of the complete blood count, so the hemoglobin, leukocyte count, platelet count, and the BMI. So it's all really simple stuff that every cancer patient has. We published this in 2008, and since then it's been validated in over 13,000 patients. So it's been studied sort of left and right, and every study that's looked at it in a careful way has been able to validate it. So it's accepted by ASCO as the only validated risk assessment tool, and it's great because it uses these simple variables, and you can really identify high-risk patients very quickly. So the take-home message is there are some cancer patients that are really high risk for blood clots, and that risk is preventable. So identifying them partly by screening. So if somebody has a score of 3 or higher, maybe you should be looking at the lower extremities, making sure they don't already have a blood clot. And partly by using prophylaxis, preventive therapy. And at least educating patients, making sure they understand the warning signs and symptoms of DVT and PE is really important.